Things often happen when we least expect it. A person can go into cardiac arrest at any time, even while performing something as mundane as exercising on a treadmill. You see, according to the 2024 Heart Disease and Stroke Statistics Report of the American Heart Association, every 40 seconds, someone will experience a heart attack. Within a year, 436,000 Americans die from cardiac arrest, with 350,000 of those being out-of-hospital cardiac arrest. Out of those 350,000 patients, only 40% received the help they needed from professional medical providers. And as you can guess, the rest, they don't make it. In fact, most instances of OHCAs can take place at the most random places: schools, restaurants, malls. And if not treated immediately, it can often be fatal, leading to brain damage, which can take place as little as 4 minutes, and even death. As a result, every second of immediate help is crucial to a person's life.
Knowing this, how can bystanders like us help in these situations? How can we contribute to the 40.2% of people that are willing to step in and save a life? The answer is simple. Get yourself CPR certified. Professor Solanki of the JC College of Nursing defines CPR as basic life support to help oxygenate the brain and the heart if a person becomes unconscious, so the normal heart and ventilatory action can be restored. Not only is this process simple and easy to learn, it's also an easy way to help prevent one of the leading causes of death, along with drowning, strokes, choking, and even drug overdose. By ensuring you are CPR certified, you can make sure that if you ever see this occurring in public, you can intervene to help save a life. For you to be more comfortable with the idea, why don't we start a little introduction of what a standard CPR would look like.
The actual process of CPR is very simple. Based on Professor Solanki's instruction and my own expertise, the first step is to approach the person if the surroundings are safe. Pro CPR's article explained that when conditions are hazardous, you may not be in the best position to help. Especially in the event of an electrocution or a car accident, your best option is to call for 911. Second, check for any responsiveness and have someone call 911.
Are you all right? You, call 911.
If you feel no pulse, see no chest rising, and extreme gasping, immediately start CPR. Interlock your fingers, place the heel of your hand in the center of the chest, and push down 1.5 to 2 inches deep. After 30 of these compressions, or 1 set, you should give 2 rescue breaths. Rescue breaths are done by pinching the nose, breathing in, and placing your lips tightly around their mouth so that no air escapes when you blow. Make sure that their chest comes to a complete rise and fall before starting again. A rescue breath should take about a second. Afterwards, simply ensure that CPR continues and make sure to switch operators every 2 minutes or so if possible. This prevents exhaustion and slowing tempo. Simple, isn't it? Realistically, there are different variations to CPR. For example, different steps for infants or when using an AED. There are also laws that you should take into consideration.
For example, getting CPR certified brings within some responsibilities under Good Samaritan laws should you ever be in a situation that will require that you perform CPR. First, you should always make sure performing CPR would not put you or the victim in danger, and the CPR being performed should correct and effectively be carried out. Next, don't use excessive force or stop if the victim stops breathing. CPR should be continued until the moment emergency services arrive next to the victim, at which point you should immediately move aside and explain the circumstances and everything you know. Additionally, CPR Tampa's article states that if a court finds that you acted with gross negligence that caused significant unnecessary harm to the victim, you are legally responsible for your actions. As a result, know your limits and practice your skill. Don't let this discourage you, however, because there are plenty of organizations and people out there willing to teach you and have you CPR certified.
To get certified with organizations such as the American Red Cross or the American Heart Association, simply schedule a class with them using your location. For example, the American Red Cross have 3 different types of classes for you to get certified. The first type is a physical class which takes place in your typical classroom setting. Doing this will allow you to have hands-on learning and practice with a skilled instructor. It will also provide you with a 2-year certification. The second option is online, where you will learn through videos and online classes. However, since the instructor cannot be physically present to observe your training, some businesses and organizations may not accept the certification. The last option is a hybrid learning, which consists of self-paced learning and in-person sessions and practices. This type of class will also grant you your full certification in CPR. However, don't limit yourself to these sort of options all the time. Indeed.com also suggests that other locations such as hospitals, community health centers, fire departments, and even community colleges will be able to provide you with CPR classes. Students, look and see if your school or club organization will be able to provide you with free CPR classes to get yourself certified.
As the comment before suggested, CPR is open to everyone as young as adolescents. All you need is strength, practice, and even better, certification. In conclusion, getting CPR certified can help save lives and make sure that if you are ever in a scenario where someone may need CPR, you are prepared and can act to save their life. The simple technique involving chest compressions and rescue breaths can go a long way. Additionally, the process of getting certification is simple and fast and can be learned in a variety of ways. Remember, the power is in your hands. Sign up with this QR code to get certified today and save a life.